Mr. President, I know my colleague, Senator Landry, was going to go next, but I'm going to switch times with her, and I know she's going to be joining us here on the floor shortly. But I want to join in to this morning to talk about this important issue of controlling health care costs, because that's really why we are here. We know that Americans are facing higher and higher health care costs, and we know that we can do something to help drive down the cost of our health care system. And we know that healthcare costs are not only strangling us, but they are impacting our constituents, they are impacting our budgets, and they are leaving 47 million Americans without insurance. Our aim is to promote better quality care and get costs under control, and whether those costs be to consumers who are struggling to pay their insurance premiums or to our government, we need to make sure that we're doing all that we can. So doing nothing in this debate is allowing healthcare costs to continue. So I want to make sure my colleagues on the other side of the aisle who talk a lot about this legislation understand that if we do nothing, we are going to leave the American people and our budgets in serious danger by not controlling health care costs. As always in this debate, we must keep in mind that federal spending, the numbers on federal spending are stark. In terms of doing nothing, if the U.S. government does nothing, health care spending will double in the next decade. That is, we spend about $810 billion on health care. That's 1/3 of our total federal budget. And if we do nothing, federal spending is going to go to $1.56 trillion. That is because we are not controlling health care costs, and baby boomers are reaching retirement, and Medicaid and Medicare costs are ballooning. So 1/3 of our federal budget is a big enough bite, but if we do nothing, then our health care priorities are going to push out other priorities of our federal government. And the biggest area where we could control cost is in Medicare. Medicare is 57% of all federal spending, and it's getting bigger. By 2020, Medicare spending alone will reach $1 trillion, doubling the $466 billion we spend today. That is to say that Medicare spending has been doubling in the last 10 years, and if we do nothing, as our colleagues on the other side of the aisle are suggesting by not moving forward on this legislation, then it is going to double again. And this is unsustainable, because if we don't address this, Medicare is going to bankrupt us. Now, the prospects are just as daunting when we come to our Medicaid budget, because Medicaid spending over the next several years will also double, and it has doubled in the last 10 years. And states are struggling, as many of us know, on what they can do to help sustain Medicaid, since they pay for part of that for individuals. So you see, we are really in a situation where doing nothing is an irresponsible way to go. In fact, for our constituents, they're seeing 120% increase in insurance premiums. And while we're worried about the impact on the federal government, they're worried about the impact on them, on their individual budgets. That means that the average family today pays about $7,000 more per year for the same health care benefits that they had just a few years ago. And if you think about that, that means that's less money for them, less money for their families, less money to meet the other bills in the family. But why has this happened? If you look at what's happened in our country, we see that wages have not gone up. In fact, during that same 10-year period of time, wages have only gone up 29%. Health insurance premiums have gone up 120%. And where has the insurance industry been? The insurance industry has seen a 428% increase in profits over the last 10 years. So that's why we need to do something about controlling health care costs, Mr. President. We can't let the American people continue to be subject to such huge increases in premiums and then have the insurance industry walk away with huge profits and American consumers make less and less. So what's going to happen if we do nothing, if we don't advance this bill to control health care costs? Well, those same premium increases that we've seen in the last 10 years are also going to go up again. In fact, they are projected to go up another 7.9% in annual growth. That is, every year they're going to go up another 8% a year. And that is unsustainable. That means somebody is going to be paying $10,000 or more than what they're paying for their health insurance today for the same health care benefits they have now. That's why doing nothing and not advancing this bill is just acquiescing that everybody is going to pay more for health care. What makes this number so scary is that it is really 4 times the rate of inflation over the same period. That means that what we need to do is look at general inflation. It's usually about 2%, but healthcare inflation, as is shown on this chart, is more like 8%. So if we do nothing to change this, Mr. President, Americans are going to be continuing to have to do with less because healthcare costs are demanding more and more of their budget. So what do we do about this? Well, we certainly want to make sure that we change the system. And that's one of the reasons I support driving down costs by having a public option. We know that 2 factors are involved. We don't have enough competition. There are very concentrated markets in health insurance across the country. Many times there's only 1 or 2 insurance providers providing coverage in a market. They might have 94% of the market, and it's too concentrated. And we know that if we provide an alternative in the marketplace, we can help drive down costs. One provision in this bill that I'm very supportive of is the basic health plan, because it lets states negotiate with private insurers for lower costs. In my state, this program has been in place for 20 years. And what it's been able to do, it has been able to provide those who participate in the program, about 70,000 people today, 30 to 40% savings for those same individuals if they had to buy that plan as an individual from a private insurer. Now that's incredible success in driving down the cost. And why? I call it the Costco model. Because my constituents, just like when you go to Costco and you buy in volume, the state of Washington buying in volume on behalf of those individuals was able to drive down the cost of health care for those individual citizens. They were able to choose between 4 different plans, and they were able to get access to a very good proposal for health care for them. Now, the underlying bill includes language that says that you could provide this basic health plan if states opted into it and cover 70% of the uninsured who are currently uninsured in America. I like this proposal because it gets us cheaper insurance for that population. Why subsidize insurance companies by giving tax incentives to buy more expensive insurance when what Americans really want is to drive down the cost of health care by having the same negotiating clout that big businesses or other entities have? So I hope that we can continue to work and maybe even expand this provision to make it even more robust and to drive down costs. What's clear is that the cost of the uninsured are adding to our health care costs. In fact, the fact that there are people in America who are uninsured are adding about $1,000 to our health care premiums overall. That's about $43 billion a year to our health care system. So if we could change our health care system and get more people into something like the basic health plan, we would be able to drive down costs, and that's why that plan is so valuable. But we should not forget that our current system, besides insurance reform, we need to have provider reform. And the reason why provider reform is so important because our current healthcare system is flawed. It is driving up the cost of Medicare and healthcare in general because of the payment system. The current payment system just perpetuates more spending. In fact, there is something like $700 billion in waste in our current system. And if you think about it, it is this fee-for-service loop that I call it, that just basically you order more and you end up having more waste in the system and you have more spending and you have more use and it just keeps going. And that is primarily because we pay doctors on volume. We pay doctors for how many patients they see every day, and we pay them for how many tests that they order. And so consequently, the controls just continue to spend out of control. As I was saying, we spend about $700 billion on health care that we don't need to spend. That is in duplicated tests, unnecessary procedures, excessive insurance overhead, uncoordinated specialty care, and preventable hospitalization. We heard from many people during the healthcare debate that we have got to do something to change this system. In fact, one of the witnesses before the healthcare committee said, we've got to go after how we reimburse physicians. The whole system is the most broken part of Medicare. So what are we doing in this legislation to fix that? We are changing the way we reimburse for health care. In fact, we are going to look at how to get lower costs with better results. Now, this is really important because I don't think there's a person in America that wouldn't tell you they know what it's like to go into a doctor's office and feel like they're always in a hurry, or feel like they may not have heard everything that you had to say. Well, this is about changing and rewarding physicians on the outcome of your health care so that you can have shorter waiting times, better access to your doctors, more coordinated care, and better outcomes. We think if you change the health care system, which this bill does, to drive down costs and give better outcomes, we are going to have better health care in America. Now, we can continue on the path, which I think my colleagues on the other side of the aisle, by not voting to move forward on this legislation, are supporting. We can have less coordinated care. You can have people go from specialist to specialist without having that care coordinated. You can have more unnecessary tests. But then everybody in America is going to be paying for those costs. Everybody is going to be paying higher health care premiums because of it. So what we really need to do, which is what exactly this bill sets us on a path and course to do, is to pay for value, not for volume. To pay physicians on the value that they deliver in the outcome of their patients instead of volume. And Mr. President, if we did nothing else in healthcare reform but to change our payment structure, to focus on this premise, paying for value and not for volume, then we would be delivering great long-term savings to our healthcare system. But we have other things we need to do, and that is in the area of long-term care and Medicaid, because our long-term care system also, we're seeing a doubling in healthcare costs, and primarily because of long-term care. Long-term care is, when you think about our Medicaid budget, everybody thinks of Medicaid as this program to help the low-income population. Well, Medicaid is turning into a long-term care program for the elderly in America. That is, they can't get long-term care access, so they're spending down, so they qualify under Medicaid to basically get on that system to cover their long-term care. So we can see that right now Medicaid is paying half of its funds, and that is an expense that is going to continue to grow. Now, we have made some reforms in the state of Washington to make that cheaper. We have said, let's invest in home care instead. Instead of having everybody go to nursing homes, whether they need to be there or not, let's focus on the long-term care system reforms that put people, keep them in their community, and instead use the Medicaid budget to advance other things while keeping patients at home. I think every senior in this country would rather have their health care delivered at home than in a nursing home. But our current federal system continues to reward long-term care in nursing homes instead of in community-based care. This legislation starts us on a path to change that direction, to move closer to long-term care community services. Now, we did this as the state of Washington, again, over 20 years ago, and have reaped huge benefits. If you took the same individual that we would have in the system today, the cost is only about $22,000 per individual. If we had not reformed the system as we did 20 years ago, we would be paying $42,000 for that same individual. So we have been able to drastically cut the amount of money that we are spending on long-term care. And so this legislation includes the same kind of cost control reforms in long-term care as some states have already implemented. And that's why we have to get at controlling healthcare costs. If we don't control healthcare costs in this area of long-term care, we are not going to control healthcare costs overall in America. So, Mr. President, what does reform need? Why are we here today to talk about the cost of health care and what we need to do? Why are we here to talk about advancing this legislation so that we can get this debate on the floor for the American people? Well, it's clear, Mr. President, that we need to have more competition through a public option. We need smarter reimbursement rates to incentivize value, and we need better use of Medicaid and dollars.
Time has expired.
I thank the President, and I hope that my colleagues on the other aisle will consider the important cost controls in this measure.